This is the kind of picture that comes to mind when we talk about daycare. Um, and since the start of this pandemic, we know that kids getting the coronavirus are less than 10% of the total cases, but the risk of getting severely ill or dying is far lower compared to adults, especially for those with multiple risk factors. And early in this pandemic, a third of the jobs for providers working in daycare centers were lost. Um, More than half of all daycare centers shut down during this pandemic, and a little over 40% remained open for those essential workers. And the debate for reopening for daycare or schools have continued with the risk that's or with the question that could the kids be transmitting the disease to adults at home and posing a high risk for those with the multiple risk factors to ended up needing to be in the hospital or dying. This is the largest study that has tried to answer um, the question whether COVID-19 transmission goes up within U.S. childcare programs. And this study was published in earlier this month. It was done in Yale University, um, and they surveyed over 57 childcare providers who either worked earlier in this pandemic, worked in person in childcare programs, either home based or center based, versus those providers who ended up staying home. And they looked into the risk of these people getting the COVID 19 or ended up needing to be in the hospital. Most of the kids that they cared for were under the age of 6 years. And what they found out that the odds for you as a provider working in person in childcare programs is not higher compared to those who stayed home. And the question is why that daycare centers did not increase the risk for those people who works in childcare in person. And the answer is most likely due to the many measures that have been taken in these childcare programs and were implemented uh, in all these various programs. And we know that the CDC have laid out a very detailed, very comprehensive guidelines into social distancing, um, intensifying cleaning and disinfection, limiting the group and the cohorting. And these in this study, that the numbers were between 6 to 8 kids being cared in one location compared to it depends if it's home based or center based, and then modifying the pickup and drop off procedures, having multiple different kind of procedure on screening tools, and also like adherence to face mask for all kids above 2 years of age and for the providers. So the the author ended up concluding that within the context of considerable infection mitigation efforts in U.S. childcare programs, exposure to childcare during the early month of the U.S. pandemic, COVID-19, was not associated with elevated risk for COVID-19 transmission to providers. These findings must be interpreted only within the context of background transmission rate and the considerable infection mitigation efforts implemented in childcare programs. Thank you.